10 years ago, she was told she needed a knee replacement. So we have...
My friends call me Shane.
Shane, okay. So she was told 10 years ago she needed a knee replacement. She obviously has arthritis in the knees. But what they didn't tell her is that she's flat-footed. Now, had they told her she was flat-footed 10 years ago, or even 20 years ago, better yet, 20 years ago, she wouldn't be in this situation in the first place, okay? She would be walking around, climbing stairs up and down. And me and Shen share the same birthday. And I'm not gonna tell you what that birthday is, but it is in May, and we're both Geminis, and we only have 4 days. She's here from India, okay? So we examined her, scanned the feet. We also not only scanned the feet, but checked her ankles. So we're gonna adjust her ankle. That needs to be adjusted on the left side, and we're just gonna do some ankle adjusting, and then we're gonna fit her for some custom orthotics, which show you the scan of her feet. She is completely flat-footed, and when you're flat-footed, done so many videos on that, you rotate your knee in and your hip forward, and not only does that cause knee problems, but it can cause hip and lower back problems as well. So the laser is for the pain now, the swelling now, the arthritis. That's going to reduce the inflammation, reduce the pain, make it more comfortable for her. It's going to take a couple of treatments. We don't have a lot of time. We have 4 days and it's the weekend. So we'll see her tomorrow on a Saturday. Our office is open on Saturday, lucky for her, and not as lucky for me, I guess, because I have to work Saturdays. But after that, we're gonna give her a series of exercises, which I'm gonna share with you guys, so hang tight. So what she's dealing with is her main complaint, and this told me everything I needed to know. She told me she had pain going downstairs, worse. Going upstairs was bad, but going downstairs was worse. And she also told me, the first thing she told me was that her knee pain hurts only after she sits for a while. And when she goes to stand up, it takes a while for her to straighten her knees out and for her to be able to start walking. So right away, both of those symptoms, both of those descriptions tells me she has a weak quad, okay? So she needs to strengthen the front of her thighs, which connect to the patella and into the knee joint. I'm gonna give you guys also a series of exercises to strengthen the quads so you don't have any problems. Now, let's say you just have knee pain going downstairs. It's a weak quad most likely, you know, barring any soft tissue damage or anything like that. And if it persists after doing these exercises, you may want to go and get an MRI done on your knee. But these exercises will help with anybody that has knee pain after sitting for a while and they can't stand up and straighten their legs for, it takes a minute to do that, or for somebody that has difficulty or pain walking downstairs. So again, we're lasering to reduce the inflammation now, to help with the pain now. We're fitting her for orthotics so she can go ahead and fix the flat feet. And then my only other recommendation besides fixing the flat feet, lasering the knee to reduce the inflammation there from the arthritis, strengthening the quad, only other, I guess, advice would be weight. Right? So we want to make sure our weight is in check. And when our knees hurt, it's hard to exercise. It's really difficult. So we want to get her knee pain to reduce, and that way she can walk, she can do things and burn some calories. I gave her this example earlier. When you weigh 200 pounds, every time you take a step on those feet and those knees, you're adding anywhere from 200 to 600 pounds of pressure on that knee every step. If you're running, you're adding 6 to 1,000 pounds of pressure. If you're jumping, over 1,000 pounds. So that's a lot of pressure and impact on the feet and the knees. And after a while, they wear down. So we need to strengthen these quads. And the orthotics are the long-term fix. And so is the weight. The better your weight is, the overall better your health is. So cardiovascular wise, you know, so there's so many positives with that. Okay, so now that we've finished lasering her knee all around the knee joint, we're now going to go ahead and adjust her ankle. So her talus is out of place, and obviously the functioning of the foot and ankle are important when it comes to movement and function of the knees as well. And sometimes we adjust the knees as well. Okay, so just relax here. Yep. Okay. Good. Okay. That's it. That's a talus adjustment. It's not difficult, but can prevent you from dorsiflexing your feet or your ankles back to your head. So I'm gonna let that settle, and I wanna see how you're feeling tomorrow, okay? You're all set. So that's our approach to knee pain, especially when you've been sitting for a while and can't stand up straight, or knee pain due to arthritis, or even knee pain when you go downstairs. And if you have knee pain when you go upstairs, we'll do another video on that.
Sit in a chair and turn the foot of the affected leg slightly outwards. Straighten your knee, keeping the foot turned outwards as you lift it off the floor. Hold a stability ball against a wall, placed in the small of your back. Lean firmly back against the ball. Walk your feet forwards, keeping your toes pointing ahead and your legs at hips width apart. Squat down, dropping your hips towards the floor and bending your knees until they reach 90 degrees. Stand up straight, driving the movement with your buttock muscles. Make sure your body remains straight and knees travel directly forwards over your toes throughout this exercise. Start in a seated position with a band around your ankles. One leg is going to act as an anchor whilst the affected leg is going to do the work. Straighten the affected leg out in front of you against the resistance of the band. Control the movement as you return to the start position. Stand up straight with a chair positioned behind you. Take a small step away from the chair. Transfer your weight onto the leg you would like to exercise, lifting your other leg in front of you a little. Focus your gaze directly ahead, activate your abdominal muscles, and keep your back straight. Bend your knee and push your hips back behind you, aiming to sit down on the chair. Ensure you keep your knee pointing directly ahead. Do not allow it to drop inwards. Your back should remain straight with your gaze in front. Once sat on the chair, lower your elevated leg to the floor, and stand up using both legs. Repeat this movement. Sit on a chair and tie a TheraBand to one of the chair legs. Place one foot in the loop. Now stretch your knee as far as possible to the right. Hold, then return to the starting position. Repeat the movement to the left. Set up the seat length, the height and leg supports to suit. With the lower pads on your lower shins, gently extend and straighten your legs. Pause briefly at the top of the movement and then lower the legs back down in a slow and controlled manner. Sit with your legs out straight and take support from your arms behind you. Place a rolled towel under your knee. Push the back of your knee down against the towel and then straighten your leg, lifting your heel from the floor. Hold this position, then control the movement back to the start position.
Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.